Yeah, thanks for the embarrassing introduction. It's a pleasure to be here. I know quite a few folks here at Peabody and Vanderbilt, and so it's been great to be here. First time in 7 or 8 years, I think, and look forward to meeting more. So I'm going to talk today probably about 10 or 15 minutes about a global process going on right now around the Sustainable Development Goals and the place of early childhood in those, but then move to a specific project in the country of Chile that I've been involved in for about the past 6 or 7 years. So that illustrates, I think, some of these dilemmas around scale, quality, how to improve quality in a sector of education like early childhood education. So I'm going to talk a little bit about a process that's been about bringing the advances in research over the last few decades around early childhood development, which probably on some level many of you, or if not all of you, are aware of, but bringing that to the global development community for whom it's not really a given that it's known in the development of the post-2015 Sustainable Development Goals. And then move to this issue of quality. Talk about a project that moved from a kind of pilot phase to a experimental evaluation phase to a scale-up phase with kind of different implications for research methods at those points. So, so the first part is really a quick overview of a very I would say kind of strange and interesting and very complicated process that's been the past year and a half or two of work building up to what will happen in September 2015, which is the announcement by the Secretary General of the next set, the successor to the Millennium Development Goals, which will be called the Sustainable Development Goals. Now, how will the SDGs, as they're starting to be called, be different from the MDGs, which were the UN's stated goals for all of its member nations, some 190-something member nations between the years of 2000 and 2015. Well, first of all, the process has been a lot more open. The MDG process was essentially a within the UN agency process, a kind of closed-door process in 1998 and 1999. This current process has been intentionally much more open, which has made it, I'm sure, somewhat more chaotic and unpredictable. But here are some of the ways it's going to be different. The language is, for those of you familiar with the MDGs, a lot of the language was around extreme poverty reduction. So a lot of focus and relevance to low-income countries in particular, but low and middle-income countries in general, and not so much with high-income countries. Now, the word sustainable should signal to you that there may be kind of shared responsibility for the sustainability of the planet, and therefore the language is being written to be relevant to high-income countries, not just low and middle-income countries. And the context is greater awareness that many planetary boundaries, which is the kind of guiding metaphor of a group of climate and other scientists in some work in Nature, article last week in Science that you may have read about in the media. And some of these things I'm sure you've read or know about greenhouse gas emissions, biodiversity, issues that are still remaining and unsolved from the MDGs, like extreme poverty, the food crisis, things that we talk about a lot in education, like rising inequality, conflict and violence, and the role of education in that, continuing health challenges. And I think one of the ways that we can think about these is that these will be interconnected challenges. The most central one is how do you finance progress on all of these when they're all fairly urgent matters. This is the updated graphic. This group of scientists, about 30 scientists from the Stockholm Center led by Johan Rockström in 2009, came up with this idea of 9 indicators that are critical for the future of the planet. And at that point, 3 were being exceeded. Now, in last week's article, they showed evidence that 4 of these 9 were being exceeded. Now, to some extent, this is a rhetorical device because it's about trying to present a bunch of the global issues on one diagram. And this has a focus on the planet, not so much on the human capital aspects. But certainly human capital and health will remain important to bring about change in any of these kinds of severe issues. So my role in this has been as in leading the early childhood work and co-chairing the education group of a research network that is the it turns out there have been thousands of advocacy groups pressing for particular goals, targets, and indicators for the SDGs. And Jeff Sachs, who chairs this network, came up with a strategy based in part on his experience with the MDGs, which was to put together a network that at every point was a few months ahead of the UN process. So our group came out with a recommended set of goals, targets, and indicators that was manageable, 10 goals, 30 targets, 100 indicators total, with each of the work groups working on a particular area of goals about a year and a half ahead of time to come up with recommendations and then be pretty ruthless about reducing them to a number that countries would find manageable. So that is now providing input into the process since we were the only group to actually propose a full set of goals, targets, and indicators that was informed by a pretty heavy dose of research in each of these areas. So these were the 10 that were proposed back in February. The Open Working Group of the United Nations came up ultimately with 17 in July, which the Secretary General essentially did not edit in November of 2014. And they cover essentially all of these areas and a few more. But the area I'm going to talk about is really this area of early childhood development. And one of the concerns of the global early childhood development community was that the MDGs did not have any presence of early childhood aside from infant mortality and maternal mortality. And those two happened to be areas where there was a lot of progress on the goals. And essentially the goals that had advocacy, organization, and influence between 2000 and 2015 achieved large amounts of progress. So, of course, primary education in the field of education was an area where there was enormous progress on one indicator, which is access. And there's also a sense that quality didn't really move along at the degree that access increased in low-income countries, but there were enormous increases in access. Attendant policies like the abolition of school fees in many low-income countries. Other goals that didn't have such advocacy and organization didn't do so well. Sanitation is one of them. So we can think about progress on goal setting, as we know from any organization, is very important. It can set benchmarks and indicators, but it doesn't assure that progress is going to happen. But the fact that early childhood was not represented beyond issues of survival led to this movement over the past several years to bring this issue of thriving and of learning and health beyond survival to bear on the SDGs. And so one benefit that we have as a field is the past 2 decades of increasing visibility and research coming from neuroscience and economics to bolster the evaluations that all of us are familiar with, like Preschool and Absenteeism project. And so we have a, as folks in the development sphere say, we have an enviable set of evidence compared to some other areas. If you think just in the US context, what was the evidence base for kindergarten when kindergarten expanded? Well, we now have quite a lot of evidence for pre-primary education for 4-year-olds, and that has gotten stronger over the past 20 years with evaluations that are not just in the US but also in other countries. And we did have in the Education for All goals, which were the spin-off within the realm of education, with UNESCO being the lead agency, a set of Education for All goals, of which the first one was to expand and improve early childhood care and education. But again, this was not in the MDGs itself. So we participated in some of this kind of making the case, bringing science to the public and to the relevant audiences to We, at the beginning, didn't really quite know who the audiences were or who the decision makers were. It turned out it was a group of ambassadors. So if you want to make a difference in this process, it ended up that the ambassadors of the countries that were on the committee of about 45 countries working on the first draft of the SDGs were the key people. And just like we learn about in policymaking in the United States, these are not necessarily folks who have content expertise in what you're going to talk to them about. So the same issue of kind of policy briefs that speak in everyday language about the importance of children's development and learning was extremely important to even get our foot in the door around this process. And so ultimately, our network presented a 50-minute slide presentation across all the areas of goals. So I, as the co-chair of the education work group, was allowed 2 slides on early childhood because my other slides were on primary, secondary education, and higher education. So, well, I'm going to give you very quickly the 5 slides that I thought I would present, and then they cut it down to 2. So these are things you're probably familiar with. Some of this comes from the Center on the Developing Child at Harvard University, which are the kind of framing. But this was the link. We had to somehow make the link to why is it that children should be the focus of sustainable development. Well, there's a very strong demographic reason, and there's a very strong future-oriented reason, and so it was these kinds of statements. Plasticity had to make an appearance. What we are learning about the very high levels of plasticity in the first years of life. This is from Pat Levitt, who's on the National Scientific Council on the Developing Child. He's at UCLA, and you know, you've seen many of these graphs. The Heckman slide is the most famous one, and so certainly we included that. But then economics had to also be included. So these are estimates by some of the more influential economists in global early childhood, like Harold Alderman and Jerry Behrman, that were published in The Lancet about what it would do if we raised pre-primary enrollment to 50%. So I asked them to add to those estimates what would it cost around the actual language of our proposed target, which is 100% enrollment in pre-primary. And then some recent longitudinal data. If there is a kind of peri-preschool for global ECD, it's the Jamaican Roving Caregivers Project, which at its 20-year follow-up produced higher IQ, reduced depression, reduced violence, and 50% higher earnings, and work by Paul Gertler and Jim Heckman. And then we presented one of these correlation isn't causation, but it still looks pretty good kinds of graphs. So if you graph the Human Development Index, which came from Amartya Sen's work and has been the UNDP's indicator of societal development for quite some time, and you line up the values of these are primarily low-income countries with the UNICEF measure, which is the Early Childhood Development Index, a multi-domain caregiver report of how kids are doing between the ages of 3 and 6, lo and behold, you find a very high correlation. And you don't talk about anything else around causality. But you showed the correlation. So that was essentially the argument. And our proposed goal, which is very similar to what the Open Working Group came up with, was a shift to learning from the idea of inputs. Rather than simply let's assure quality early childhood education for all, for example, the goal is ensure effective learning for all children and youth. Our proposed early childhood development target, after input from about 50 to 80 people and a ton of wordsmithing, was around, first of all, note the universality. So if this is true for all countries, this is not simply about reducing risk, but about ensuring developmental potential for all children. And the language includes both inputs and outputs, some idea of developmental potential with that defined in a multi-domain way. And so we, one of the problems with indicators is that if it's not already being measured, you can't really propose it on a global scale. And the closest thing we have is the UNICEF Early Childhood Development Index, which if you're actually an early childhood measures person is not a great measure. But it is the only multi-domain, it is adult report measure that is being gathered in over 60 countries, 60 low-income countries. So we could say that there's a large number of countries that are measuring it. Now, of course, there's a little bit of pushback that none of the OECD countries are actually using this measure. Though many of them are using items along those lines, and so some of the argument from here on in will be about convincing some of the richer countries that it will still be useful for them to think of this. But the idea is that even if it's caregiver report, it's our foot in the door to be able to say the principle of a multi-domain index of children before you start looking at something like the completion of primary school, which is also being proposed, that we should know something about how young kids are doing at some point prior to entry into primary school. And the second one, and it turns out this one is the one that's in there right now, is all children receiving at least 1 year of a quality pre-primary education program. So this is what is most likely to be adopted in the SDGs. But there are many other indicators under these other goals, and so one of the other things our network is pushing for is age disaggregation, so that governments are not just simply breaking out indicators by, okay, let's break out an indicator of poverty reduction by families with children, period, 0 to 18, right? Like that we might want, with a developmental perspective, to break out early childhood from primary school age to secondary school age to the transition to adulthood, childbearing age. And so that's what our network is recommending, and the UN Stats Division is thinking about in terms of disaggregation indicators. And within early childhood, we are recommending 0 to 2 and 2 to 5 as minimally capturing something like the first 1,000 days and then the pre-primary ages. So these are the current current language in the open working group, which the Secretary General essentially endorsed. And from here on in, there will only be cutting. There will not be any adding between now and September. We are trying to push. And one thing that this process has done, which I think is useful, and you don't realize how unusual it is until people keep talking about how unusual it is that the World Health Organization, UNESCO, and UNICEF, as the lead agencies on, if you were to pick agencies responsible for early childhood development, are actually working together on this issue of a early childhood set of indicators. And we know we will be lucky to get 2, super lucky if we get 3. So we are pushing right now for this idea of the Early Childhood Development Index, a multi-domain measure of child development. And yet you see the word quality. Quality, you know, is probably going to end up in the final language, and yet there is no definition of quality in the indicators that have been presented so far. So if we move forward to implementation, there's going to be a question of what is quality? How do you define quality? And then there are going to be, need to be the supports for data. And so there's a lot of action going on right now around how to think about the data quote-unquote revolution that will be required to keep track of this new set of indicators post-2015, which will be broader than the MDGs for sure. And then the other remaining challenge is the challenges for finance, for public investment, for public-private partnerships, for private-private partnerships, and a much expanded set of mechanisms. And there is talk of a new global fund for education that will be a pooled set of resources that would replicate some of the big successes in public health, like the Global Fund for Malaria and Tuberculosis. And that fund had a huge success in lowering rates of malaria and tuberculosis with coordination across foundations, governments, and large lenders like the World Bank. Unfortunately, early childhood has been left out of a lot of initial estimates, including the estimates of what it would cost to achieve education indicators. So we are currently working right now on trying to get a small group of economists to work on the early childhood issues to come up with some estimates and what might be some of the implications for finance mechanisms. Any questions on this process before I turn to just a regular research study? It's been certainly an interesting process. I had no idea what I or my colleagues were getting into about 18 months ago, but it's been quite fascinating to see how pieces of this process work. Yeah.
curious about,
Doug.
I assume that the early childhood was left out of the MDGs because it was more of a challenge to measure than, you know, standard educational enrollment and that sort of thing, which was already being collected or more easily collected. And so for the ones you've described for early childhood, they're survey-based, you're saying, and there's a sampling involved? Or are they trying to survey, they're not trying to survey everybody, presumably?
Yeah, so it's interesting. So what's happened is the UN Stats Division is putting proposed indicators through feasibility kinds of analyses, right? So it's very easy with things that have been collected for a long time. So infant mortality, I mean, there's a set of things that have been collected in large-scale national data sets, like the demographic and health surveys that are international, other sources of data, a lot of it UN directed data collection. So if something already exists in one of those, then it's kind of in there. And pre-primary education enrollment is something that's considered collected because UNESCO does collect it. You can argue with the quality of the data, just like you can with primary enrollment rates, just like you can with secondary enrollment rates, those kinds of things, but they are collected. So that's one of the reasons why pre-primary floated to the top rather than this other index, because even if UNICEF has been collecting this early childhood development index in 60 countries, they are poor countries, and so one of the things that hit me when I was going over some of the responses a few months ago was, yes, you know, it's the rich countries that were pushing back on this, and they said, we don't collect this. We've never collected this. Like, why would we suddenly up and collect this measure that's only been used in low-income countries for our countries? Well, it turns out the OECD is developing an estimate for actually a large-scale project on childcare. And so that's the plan, is to say, look, the OECD is creating a measure. And so if something is close to being created, close to being collected, it might be considered. So that's the way. But yeah, things are being rated on essentially green if there's no problem, it's being collected. Yellow if it's iffy, and red if it's not feasible. And so, for example, I think parenting, the third consensus measure that came out, the global kind of early childhood community, was safe and responsive parenting. Well, responsive parent and stimulating parenting in safe environments. I think that was the phrase. And there's one item in the mix that's collecting that, but there isn't much else, and so I think that's not considered feasible at this point. So, but you see, the chicken and egg problem is that you can't set a goal that isn't already being collected on some level, and that constrains, very much constrains, this kind of global effort. And all of this, there is an emphasis on talking about national development of measures as well as global. Because anything that's global, I mean, how do you create validity, right, on such a large number of countries? And so I think all the language is also about the need to develop national indicators. And for many of these, there's not there's not a requirement that they be exactly the same measure. Reading and math achievement is a good, you know, that's like consensus that everyone should measure it. There's not a consensus on a universal measure. There's movements towards cross-country measurement, but not yet, you know, for good reasons, a universal measure. So, any other questions on this part? Okay, so I'm going to talk a little bit about this challenge moving forward, which is going to be how do we ensure quality at scale. If this word quality ends up in something like 1 year of quality pre-primary education, how do we get to that? So I think these kinds of features, the distinction between structural quality, which are things like staff qualifications and group size and staff-child ratio, versus the moment-to-moment interactions between adults and kids and kids, that's a concept that's fairly familiar from the childcare and early childhood literatures. And so this is also true in the emerging literature, which I would say is at an earlier stage in low and middle income countries, with probably the most work going on in Latin America. But of course, in pre-primary settings in low and middle income countries, the structural features are really kind of different. So if I think of Professor Nirmala Rao at the University of Hong Kong, developed a version of the Eckers for Cambodia and had to have an item that large animals are not coming into the preschool. So clearly it's a different situation, and very basic things like whether there is access to clean water in the preschool is extremely important, and sanitation and health supports. And there is certainly very little support outside North America and some Anglophone countries around this idea of socio-emotional development. Just as an example, in the country of India, socio-emotional development is simply not measured. It is just not on the radar screen of any ministry of education at the national level or further down. It is only just beginning to be introduced as potentially a need, and so in a context of very much rote instruction in primary school, for example. We also have relatively low levels of engagement of children. And when pre-primary is introduced in many countries, in low-income countries, parents want what looks like primary school. They want kids sitting in rows and learning, often English, faster, earlier, to have that head start to be prepared for primary school. And so we know that in preschool, what's actually best for kids might not actually be that kind of teaching, and we actually know that in primary school that might not be also the best for kids. But that is what is associated with success and with schooling in many countries. So that is, if there's anything that kind of transcends culture around a lot of low-income countries, there is this notion of rote instruction and memorization and lecture. So, so there is a need for both demand and supply side interventions to, when we're thinking about quality, that we can't just do supply side provision of quality and expect that to change what parents' expectations of what pre-primary education might provide is. And certainly, I think all over the world, and including in the United States, we know how to support structural quality better than we know how to improve and support process quality. And yet process quality is more directly and strongly related to children's learning. And intensity of training matters. Research in the United States is showing the promise of observed mentoring and coaching with trust and rapport that is tailored to the capacity of the workforce. And so that is also starting to be tried in the low and middle income countries. In examples in Bangladesh, in Pakistan, and in India, for example. So I've been engaged since about 2007 in a project in Chile to bring some of these ideas, on-site mentoring and coaching, to the country of Chile to improve its quality of public preschool education through teacher professional development, with the goals of improving children's language, health, and socio-emotional development. And so I'm going to talk a little bit about two versions of this program. The first version, which was developed and then tested in a experimental design in Santiago, and then a version 2, which is a scale-up phase into another region of Chile that is more small city, town, and rural in another region of Chile. And this is in collaboration with the funder, a foundation in Santiago, a local university, the Universidad Diego Portales in Santiago, and this project started at Harvard and now includes NYU. So this combines both didactic and coaching kinds of learning for teacher professional development in somewhat similar way as some of the efforts in the United States have done. So every month, this is a 2-year program as experienced by both kids and by teachers. There are 12 cycles, 6 cycles each year, that are 1 month long, and each month has a didactic workshop of about half a day. 2 coaching sessions, where right before the coaching session, the coach discusses what he or she is going to observe with the teacher. Then there is about a 20-minute observation session, and then the teacher actually comes out. There's a teacher's aide in classrooms in Chile, and talks about what was observed. And some of this has been modeling because immediately implementing, it turned out, wasn't necessarily feasible for a lot of these language or socio-emotional strategies. And the word for coaching in Spanish is acompañamiento, which I like a lot better. I'm actually not a sports person, so acompañamiento is the actual word accompaniment, which I think is it's a nice way to think about what coaching should be if it's not evaluative, is relatively low stakes. It's about rapport and mutual and some feedback. This is just to give an idea of what some of the language and socio-emotional topics were across these 12 modules. I apologize for the Spanish, but you can just notice that there's more of a focus on language. That was their primary interest among the stakeholders in preschool education in Chile, and some of the prior work on instructional quality in Chile, which suggested really quite low levels of instructional quality, and particularly support for early language and literacy. What was ruled out by the group of stakeholders in the putting together of this program was what we might call prescribed dosage. So strategies were encouraged, but the dosage was not actually defined. And that was ruled out because they said you cannot, in Chile, tell a teacher how often to read a book to a child. This was at the beginning. This is the beginning of this process in 2007. So this is a lighter touch program than something that we might consider a curriculum that has a prescribed set of activities with frequency in them. So that's something important to keep in mind. So after a year of pilot implementation and testing of measures and some adaptation of measures, we conducted a cluster randomized experiment with 64 preschools. We followed a cohort of 4-year-old children from their preschool year through the end of their kindergarten year, and did a traditional experimental design. The control condition was a workshop for teachers and some books, but in other words, a much reduced intervention. And so, and then the country of Chile, which is this big, long, thin country, RM is Santiago. It sits just about above the middle of the country. So that's the región metropolitana of Chile. What we decided to try through videotapes was the first administration of the class, which probably many of you are familiar with, Bob Pianta and team's measure from UVA, which has subscales of emotional support, what we ended up calling classroom organization and instructional support. It turned out that the structure of the class was pretty much the same as it is in North America when we ran the psychometric analyses. And that, I think, says something about how the rhetoric and the training of teachers pretty much is congruent with the way that preschool teachers are trained in much of the United States. So they are taught to emphasize these kinds of interactions in classrooms. But in comparison to US preschools, our averages were about similar for emotional support and classroom organization, and even lower for instructional support. So if most of you are familiar with the US pattern in this, the class is a 1 to 7 scale, and we typically see emotional support and classroom organization somewhere in the middle of the scale, and we typically see instructional support falling quite a bit lower at around the value of 2 or in the low 2s. And in Chile, we found a similar pattern, perhaps even a little bit lower on instructional support. The class is also now starting to be used in other countries in Latin America. But here you can see clearly that the instructional support, the mean for the control group was around 1.8, so lower than the low 2s, which is typical in Head Start national data as well as in public pre-K multi-state studies in the United States. So what we're first looking at the classroom observation effects on videotaped process quality, on emotional support, classroom organization, and instructional support. After 1 year, we find moderate to large effects, with the largest effects on emotional climate. And by the end of the second year, now this is a separate set of teachers, moderate effects on emotional support and organization of the classroom, but almost no impact on instructional support. So what we found on children, which I'll show on the next slide, has partly to do with absenteeism. So overall, we did not find effects on children's targeted language outcomes, but it turned out that it may be that part of that story is absenteeism. So roughly on any average day, 23% of kids are missing from classrooms. Across the year, the average child misses about 1/4 of days, and we did this by going in and randomly selecting 10 days and unannounced coming into the classroom and observing attendance. This was the first time that attendance had been measured this way in the country of Chile. And so we ran a propensity score analysis. Well, actually, it's a regression-based subgroup analysis to see whether, for those who received the higher dosage, more likely to be attending preschool, whether their impacts were larger than the very small impacts that we found for the entire sample. And we did find that the effects on decoding and emergent writing were larger for those with the highest likelihood of consistent attendance in preschool, and therefore who were more likely to receive more of this un buen comienzo intervention. Then what happened in the middle of the experiment, actually before our final impacts were run, was that there was an interest from the Ministry of Education in Region 6 to implement this program. So this is one of those dilemmas you face as an evaluation researcher. What do you do when that opportunity comes along? And so we decided, after much discussion, to try to implement a process where we would learn something. And learn about the adaptability and value and acceptability of a program within this new region of Chile. And try out an approach to ownership of the program while retaining the core approaches and the core theory of change of our Un Buen Comienzo program. So, and like a lot of these scale-up approaches, try to understand how a shift from the implementing organization implementing the program to more of a ministry ownership, how that might work. We also knew by that point that we probably wanted to intensify some of the components. And so the model we used, and this is a little serendipitous, our health director knew folks at the Institute on Healthcare Improvement, which is the organization that came up with a particular approach of continuous quality improvement that right now Tony Breik has, and IES and John Easton played a role in kind of highlighting and making part of an RFP around research and practice at IES. This is an approach that's been used in healthcare, and now it's starting to be used in education. We came on it partly through our health director without knowing about Tony's work. But so this was the first implementation of this model for preschool education. And so what this method is a way, was developed initially out of the corporate sector around some of those kind of famous innovations like assembly line innovations in the 60s and 70s and in the automotive industry. That over the 70s, 80s, and 90s started being applied in healthcare by Don Berwick and a group in Cambridge. And the idea is to involve all stakeholders in the system in how to conceptualize quality improvement, how to set concrete goals, short-term achievable goals in quality improvement, and create metrics and implement metrics to track change in complex systems. So it's been used in quite a lot of healthcare systems worldwide, in Scotland, in Ghana, and with apparently positive impacts when certain kinds of health services have been rolled out across countries, for example, to reduce infant mortality in Ghana. So this was a collaboration with the Institute for Healthcare Improvement and the ministry and our implementing organization. And the key behind continuous quality improvement is to get networks of people to work together and meet every 3 months or so in learning sessions for periods of about a couple years. And the networks are intentionally, and this is similar to like a factory in the sense that anyone on the assembly line could stop the assembly line if there was a problem with quality. Principals, teachers, aides, our coaches, parents, municipality, departments of education. We have a health component, so health center representatives, and then regional ministry representatives. And the idea is they work together for a defined period of time, and they engage in learning sessions every 3 months, with the first learning session being to establish initial targets for quality improvement. They set goals that are quantifiable goals, and then design metrics to try to capture actually daily change, daily or weekly change, to see if there is progress towards those goals. And then you come back 3 months later and have a facilitated session where folks exchange what works and what doesn't work. In my set of metrics, it goes up at this point, and I think this is why. It didn't go up at this point, or it went down, and I think this is why. What do you think? And they exchange strategies, and then they reset goals. And the goals could be exactly in the same area, or they could move to one or the other components of the program. So these kind of rapid cycles, which are, of course, now becoming a quick very much a part of the vocabulary and ideas of innovation and education in a lot of different areas, is certainly a part of this as well. This idea of 3-month cycles of setting goals, measuring, and coming back together. With these metrics are called tests of change. So this is an example of one that a group of schools came up with. This is usually about 20 schools getting together in Region 6. This is a way in which daily attendance is made visible to all the kids in the classroom as well as the teacher. And so then they, on an Excel spreadsheet, track, does this actually improve attendance over time? Another example was one to eliminate kids bringing sugar-sweetened beverages to the classroom in Chile. Has anyone ever had milk in the country of Chile? No. You cannot have milk that's not sweetened by tremendous amounts of sugar. And so as a country that's making this epidemiologic transition from middle-income country to actually a high-income country, rates of obesity and overweight are the #2 health problem among preschoolers after respiratory symptoms. And so the goal for this was to eliminate kids bringing from home sweetened milk and soda and juice, and rather increase water consumption in the preschool classrooms. And so this was the measure that they came up with, which was an individualized measure. I guess there's some loss of confidentiality here, but like beads representing the drinks of water rather than sweetened soda and milk within classes. And prueba de cambios means a test of change. This is the water test of change, and this is quite a rapid and sudden change and reduction in kids bringing sugar-sweetened beverages to the classroom, and increases in drinks of water in the classroom. And the idea is that, like a public measure, kind of like those thermometer measures around fundraising, provides information that actually spurs kids to bring different messages home. And so that's yeah.
Water drinkable where these kids are, like in the schools or in the
Santiago it is, yes.
It is,
okay. It tastes pretty bad because there's a lot of chlorine in it, I have to say. It's like not my favorite thing to drink in Santiago. And so as an example around language and getting to this instructional support idea, the goal, we had shared some data from minute-by-minute fidelity data from our experimental control classrooms. We recoded the class videotapes, and there was an average of about 12 minutes of language instruction that was targeted by the program. So even though that was an improvement from about 9 minutes, that was really not enough to get us to the kind of impacts we wanted. And so the teachers themselves set the goal of increasing instructional language strategy time from 12 minutes to 30 minutes per day. And so our evidence, we continue to collect the class and child outcomes in this region and use propensity score analysis to match to the original experiment's control group. And we find, of course, this is quasi-experimental, not experimental, but that the effect sizes seem to be headed in the right direction and starting to get larger on early literacy skills. And similarly, for socio-emotional development with larger effects on prosocial behaviors, attention, and reductions in externalizing behaviors. So the response, by the way, to this has been very, very positive. And so one of the ways that we see that this works with good facilitation, and we do have pretty charismatic and excellent facilitators of these learning sessions, is that folks feel very much less isolated. So if you think about how isolating education is, imagine that then in a rural village as a preschool teacher. And as much as preschool is marginalized when you're in a village and you're really the only person doing it, it can be really quite isolating. And so the teachers have responded kind of tremendously positively. These learning sessions are structured completely horizontally so that a former minister of education might be sitting next to a parent and some teachers, and there's kind of a joint conversation about what to do around these quality improvement metrics and these kinds of things. So the Ministry of Education has now required this particular approach for all education improvement initiatives in Region 6 of Chile, including primary and secondary education, not just pre-primary. So what is the conclusion? Observed mentoring in the pre-primary setting can foster adult learning and skill development, but I think more is required. And just as in the United States, there's a mix of, there's coaching, there's a curriculum, and there's a workforce, right? And so those things, all of them have to be there for, I think, for impacts on children's learning to happen. And this process in Chile has been one of how it seems to be a multi-stage process to get to this kind of complex change within a sector of education like pre-primary. But there's encouraging efforts in other low and middle income countries like India and other places to test the circumstances under which coaching and mentoring in classrooms and in ECD centers might work, as well as in home-based programs like Aisha Yousafzai's work in Pakistan with the lady health workers, very successful program to improve responsive and stimulating parenting along with basic health and nutrition for 0 to 2-year-olds. And there are, I think, other strategies to implement this approach, this idea of model programs as hubs, which actually the federal government here has been thinking about with early Head Start childcare partnerships, transportation for mentors to reach villages and sites, and I think there's going to be a lot more use of phone and image and video capture technology around these interventions, much like my teaching partner has used in the United States. And the point of our center, our new center at NYU called Global Ties for Children, is to make sure that we are looking at measures of quality and settings as well as child outcomes when there are large-scale impact evaluations of programs for kids and youth in low-income countries in particular. So I would say the social science discipline has dominated in the first 200 or 300 or 400 of these randomized experiments have been economists. And it's been a huge and positive wave in a similar way to how IES kind of transformed the field of educational research in the United States. But what we have missed often is this idea of mechanisms, of how settings are changing, how do we measure those mechanisms. And so what we found is multilateral NGOs like the World Bank, like Innovations in Poverty Action, like the International Rescue Committee, are very much interested in what we as kind of developmentalists or as educators might bring to the picture that perhaps economists don't always pay attention to, which is the measurement both on the outcome side developmentally as well as the measurement of contexts and direct observational measures of quality. So that's the goal of our new center, which I'm co-directing with Larry Aber at NYU, and we have a group of about now 7 or 8 faculty affiliates as well as postdocs and advanced doctoral students working in sub-Saharan Africa and the Middle East and Latin America. So looking forward to your questions, and thanks for your time. Any questions? Yeah, Mimi.
So I was wondering about if you could speak a little bit about the teachers in Chile. 2 things. One is they were a little lower on the instructional measures. How does that workforce compare to ours in terms of kind of qualifications and where they come from in the distribution? And the other related question is, were there issues with teacher absenteeism, or was it purely a student problem?
There wasn't much teacher absenteeism. These teachers are quite dedicated. There was very, very long tenure in the, I think over 50% were there for more than 15 years in the system, in these public preschools, so they're quite dedicated. On the other hand, that might have been some of the challenges of introducing a coaching system and creating behavioral change when you've been doing something for 15 years, right? So even though the qualitative response was largely positive with some resistance, so I think kind of fairly typical in terms of response to kind of mentorship and coaching. Yeah, and so, and the majority had some early childhood specific training. Chile, now that I'm working more in low-income countries, it really is a very different country from those kinds of places. On the other hand, you know, you walk into a preschool classroom and there are essentially no activity centers. So one of the current phase of improvements includes some trying out of activity centers and testing specific curricula. And doing some small-scale experiments, like classroom-level experiments, to see whether those are making a difference. So kind of shorter-term, more rapid, kind of like mechanism experiment. You know, can we change classroom quality by instituting some of these things? But yeah, that's a good. I mean, activity centers are just kind of non-existent in Chile. In public preschools. That I think is, well, it's not necessarily true for all countries in Latin America, but it is true there. So yeah. So by American standards, it looks sparse. I would say by sub-Saharan African standards, it looks incredibly rich. So you know, where you might have simply a flip chart and kids sitting on the floor in a concrete room or something like that. These can look a little bit more like preschool classrooms, but compared to a high-quality U.S. preschool classroom, they still look very sparse. Fewer materials. Books are not used every day. You know, there's not a tradition of young children's literature. Books are kind of precious things. Children should not be kind of handling them on an everyday basis. Those kinds of things. Yeah. Yes.
So one of the things that's remarkable about the response to your comment is the turnover in pre-K in the U.S. is so high with the teachers. And I think you said a large percentage had been there 15 years or more, which is unusual now in K-12 and much more unusual in pre-K in the U.S. And I just wondered a couple of things. One, in some work we did in Georgia, we found it hard to move beyond a very basic level with this professional development because of the turnover. Because every year you essentially face a new workforce in the pre-K, and therefore you couldn't really build on those. You got some initial gains, but the longer term gains that we were seeing, we just didn't see anything after some initial bumps in the first year. And secondly, what's the status of pre-K teachers are they paid in the same scale that a K-12 teacher would be paid? Do they have wages that are more comparable and benefits are more comparable with other professionals in Chilean society?
Yeah, my understanding is that they are paid. I mean, so it's not like primary school teachers make a lot of money, but that they're essentially at parity. I think that's right. I doubt that the field of education is at the level, comparatively speaking, like Finland, where it's at the level of much what in the U.S. would be much higher paying occupations. Yeah, so I do think that's a big issue for coaching. Now there's lots of cities and states and localities trying out these kinds of methods, and they typically are not using, first of all, ratios of coaches to classrooms that the strongest approaches use. And so they often do things like target to newer teachers, right? So like New Jersey targets to newer teachers for intensive coaching, and then kind of just doesn't do that much with the other teachers. DC will rotate coaches so that they might work for a certain month period with a set of teachers and then move on to the next one. So as a teacher, you're getting kind of intensive coaching for short bursts of time and then nothing in between. So there's a lot we need to know about coaching interventions, about how it addresses issues like turnover and those kinds of things. But all that is to say that the structural features are still extremely important, right? And so if we think about the salary compensation and systems where if you teach kids who are 1 year older, you suddenly are doubling your salary, and or you're getting benefits, better benefits, even in like a system like Oklahoma, right, where Tulsa Head Start teachers are actually paid on par, but the benefits of the public school system are what still creates turnover and teachers leaving the Head Start system and going into the public schools. So there's a variety of things that are still, even when we think there's salary parity, that the benefits might be different. So these are huge challenges. Yeah.
I find it very impressive that you said the Ministry of Education now requires that all projects use a continuous quality improvement.
All quality improvement projects, right? Yeah. So
in our research center, the National Center for Scaling Up Effective Schools, we are using the PDSA.
Yeah, I heard.
Study Act
yeah.
process in 2 different districts in 2 separate states. I'm curious to know more about the process of phasing in that whole concept of using a continuous quality improvement process, and what did it take to go from that to the ministry requiring that is part of all projects, and you said Zone 6?
Yeah, so the ministry folks were there from the beginning at the very first learning session, and they have been going to the ones since. So this is now it's been maybe 2 or 3 years of this. And so there was a set of schools that first engaged in this and some that didn't, and we're now looking at that comparison because within region right now, the analyses I showed you was comparing that region's participating schools to the control group of the experiment, but that's a very different area, right? So, so we're now trying to compare kind of schools that went first versus those that didn't at that point initially and stuff. So, but the regional folks were there. You know, the regions of Chile are probably more like districts. It's not a huge country. The entire country is about 15 million people, so you have to think of the scale of Chile. So, so perhaps it's a little bit more like a district. It's as if the district representatives were there right from the beginning. The project was introduced with, I really think the facilitation makes a big difference, and I think we, in a sense, lucked out that there are like known wonderful facilitators at the Institute on Healthcare Improvement, some of whom are, you know, well, one of them, who I think is now the director, is South American. So he came down, our healthcare director, it turns out, was like a master at facilitating some of these sessions. So just like anything else, if you don't create the motivation and the excitement, and if it's not done well, I imagine, you know, you just have to look at the quality of how it's done. But so I think we lucked out at the beginning with that level of interest. The implementing organization, the foundation's chair of its board is a former minister of education of Chile, very popular. She carried some weight probably in introducing this to that region. Certainly our donor, who's a leader in Chile, also, you know, probably made a difference. Yeah, this is funded by a foundation, but it's the guy whose money it is pretty well known in Chile, and so so he has a certain amount of influence. So yeah, so I think those things, and the fact that also with the experiment, there's a fairly top-down culture from how the ministry works, and that both makes it easy to start implementing something new, but might mean also that something that's very inclusive like this is perceived as something unusual. That, oh, well, I've never been asked to be involved in a conversation. about this. So yeah, so that might have been there. Beth?
Could you talk a little bit about the integration of coaching on the one hand and continuous quality improvement on the other? They seem like kind of different approaches to intervention.
Yeah, so I think one of the questions that this brings up is how much a program changes. And so this continuous quality improvement model has two big buckets of ways to do it. One is when you want to come up with an entirely new program, like a new innovation. And the other is if you already have a program and you want to improve it. And so we use the version that's you already have a program and you want to improve it. So we have 4 components of the program: language, socio-emotional, health, and family engagement. And so the group is given within the parameters of the existing training and those kinds of things, and with coaches present, this idea of how would we improve what we're doing. And I think one of the ways it's not completely at odds is that, in fact, the original intervention is fairly loose. It's about, let's try to encourage strategies. It's not about saying how often, so just to take an example, book reading, let's try to do a book reading every day, or a read aloud or something like that. That was not, even though the strategies were given, there was no frequency prescribed. So you could see that, like, within even an existing intervention, it's fairly easy to try to get to this next level. But the good thing was we didn't have to say, you must do this. So they were kind of working on it. They were provided information from our fidelity study of the number of minutes and what folks were actually doing. So by recoding the class videotapes, we were able to give some very concrete information about what seemed to be going on in the Santiago, the original version of the program. And they were like, I think, it certainly kind of emerged from the group that they wanted to improve it in certain specific ways, which then I think the coaches support. And the coaches have to be in the room and then be on board with things that might involve changes in what they do. So, but you're right, it's a little bit of a interesting thing to think about. But you think about the coaches as part of the whole process, as one of the very important stakeholders in the continuous quality improvement. I don't think they meet on their own, and that's an interesting question, but yeah. Yep.
I wonder if there are opportunities you see for international, regional spillovers. I assume that Chile's in a lot better shape with regard to early childhood and primary education than, say, Bolivia or Peru, perhaps. And do you see, as things improve in Chile, that they may reach out and try to help their neighbors? And previously talked about Malawi and South Africa being in different situations.
Right.
Do you see those kind of opportunities?
Yeah, so there was certainly some interest, I think, and I haven't heard the update recently, but even while the program was being implemented from some other countries like Peru. But I think it's certainly nothing that's automatic. I think organizations like the IDB, the Inter-American Development Bank, which has a tremendous group of early childhood research policy people on its team, they do a lot of this information sharing. They are a very powerful presence in Latin America, and so they can play a role around bringing some of these ideas, and they do a lot of dissemination work that essentially is a lot of sharing information in their reports, their country profiles. They're developing a MOOC, early childhood leadership MOOC for Latin America. So they're being pretty innovative around how to spread the word around, and it's a region that leads in early childhood for a whole lot of reasons, one of which is kind of the economic development and capacity of government, which has really been increasing at, from my understanding, at very rapid rates. And when you go to countries like Colombia or Peru, at least the national level leadership have very high capacity to kind of conceptualize, think about quality, think about implementation. But then I think where a lot of it kind of starts looking different is at the subnational level and then the local level, right? So, so that's where I think things are different. And South America has a tradition maybe of sharing information that they probably don't so much with Guatemala, Honduras, and the Salvador, the much poorer countries that are in Central America. So my sense of how things get shared is that countries are more likely to kind of talk to peers that are somewhere in their economic league in terms of these are kind of upper middle income countries. Chile just became an OECD country, but you know, the upper middle income countries compared to the lower middle income countries where there's, I think, both cultural differences and this idea of, you know, economically they're very different. They're at perhaps different places in terms of the capacity to fund quality improvement strategies or increases in access for pre-primary or those kinds of things.
So in that sense, do you know if there are similar things happening in Argentina, which is their main neighbor?
Yeah, you know, Chile and Argentina are like oil and water, so that's has its own history that I can't even pretend to understand. But no, it was a very big deal that our initial project director, who has lived in Argentina a long time, in Chile a long time, but is Argentinian, got hired by the Chilean Ministry of Education in a senior post. So that's I haven't heard a lot of exchange between Chile and Argentina, but it also, I also know very little about the ECD situation in Argentina, so I don't know how that's working. Yeah.
I might have missed exactly what was happening before this was implemented, but what was the climate and what was the purpose of doing this change and looking deeper at what was happening?
Yeah, there were some studies, small-scale studies that were quite influential, and they repeatedly showed how poor quality. So there was like a minute-by-minute study of instructional practices.
Requesting those, or what was the?
Those were, you know, it's also a country that has high research capacity. So these were professors in the schools of education at places like the Católica University in Santiago doing studies of preschool quality and getting quite concerned about what they found, and those getting published and having some influence at the ministry, some overall consensus, and I would say that is shared across Latin America. This concern about the quality of education, I think it goes along with that, the general concern about the quality of education, rising inequality, lack of access to quality education for kids attending public schooling rather than private schooling across the region, and then early childhood being kind of an instance, I think, of that concern. And then these, you know, really quite good studies showing the emphasis on, just as an example, repetitive oral routines, like repeating syllables, and practicing writing, but in very kind of rote ways. Lack of attention to elaborated oral conversations, oral comprehension, very limited ways of thinking about emergent writing skills or concepts of print. Very little attention to developing vocabulary in a way. I mean, of course, you know, enriching language is very complicated, and so there's like a lot of things. So this intervention did try to introduce strategies around all those things. So extensive library, training in book reading that included some elements of kind of dialogic book reading, word walls with kind of everyday words with an alphabet, and so those get, you know, can get referred to again by the teacher. So our classrooms did look different. But ultimately, the number of minutes of increase of our targeted strategies was statistically significant, but it was, I would say, not substantively large enough to produce improvements in outcomes. And this is true in Chile as well as the US. Our associations between the class subscales and things like language, controlling for baseline language in preschool, was pretty much the same. Possibly even a little bit larger than the US studies, but about 0.1 to 0.12, 0.13 in terms of standardized associations with gains or growth in residualized growth in children's language skills. So you can have a 0.5 to 0.8 increase in class subscales, and that amounts to something like a 0.1 impact on language. And that is true if you look at a lot of the American experiments around teacher professional development. experiments in the United States, is that you can have quite large effects on the class accompanied by small effects on children. And this was something it took a lot to explain to our Chilean colleagues what was going on. And ultimately, the fidelity study, the minute-by-minute analysis, was something that really showed them, oh, okay, this is what happened in our classrooms, because they were, of course, initially disappointed by, oh, you know, big effects, what look like big effects on classroom quality. But our standard deviations are small, just like they are in the US. The class standard deviations are like 0.8 to 1. Most US studies, and ours was around 0.8 something. So, yeah, so that's remarkably kind of similar to some of the lessons in the US context.
A follow-up maybe. I think everybody in the US thinks that all children should have access and have those skills, but who's going to pay for it? I mean, there's a big, a lot of our governments don't want to pay for everybody to get that.
Yeah, I mean,
how are they funding or?
no, I mean, so it's kind of like Michelle Bachelet was like Mayor de Blasio. So when she, in her first administration, placed a huge emphasis on expanding access to pre-primary education, and then started a 0 to 6 program called Chile Crece Contigo, that is a multi-sector health and education and social protection for the most vulnerable in Chile, using their they have a national vulnerability status, which gets you extra benefits. It's based on household structure and economic indicators and those kinds of things. And so for those families, a big new early childhood program that's considered one of the model integrated or coordinated early childhood policies was developed. And so she has been a champion, and the president in between the two, she's in her second administration now, the president in between didn't roll back stuff, didn't do a lot in terms of expansion, but didn't roll back things. So like in a lot of Latin America right now, and globally, there's increased early childhood investment. Where it lags the most is in sub-Saharan Africa, and by far the most is sub-Saharan Africa. And South Asia is now also not doing that well. India has tremendous access in its huge preschool program, and it's pretty abysmal quality in that program. So that's where Latin America has made more progress, I would say, than sub-Saharan Africa. Mark?
You mentioned the 0 to 6 program in Chile, and I'm just wondering, in low and middle-income countries, given the conditions a lot of the disadvantaged children live in, the relative trade-offs between trying to scale up something in the early years, maybe moving through the health system, home visitation, we have research along those lines and so on, as opposed to trying to boost the 4- and 5-year-old infrastructure that's already there, and a little late in the game for some of these kids, I suspect.
Yeah, well, the primary way that ECD has been invested in low-income countries is prenatal to, I would say, the first 2 years. And that's because of the efforts to reduce not just infant mortality, but mortality by age 5. And so the large progress, substantial progress that's been made, and some of these efforts like malaria and tuberculosis have made a difference because they affect families, and kids are very much affected. The other great big killer is diarrheal disease and lack of clean water and sanitation, right? So for kids. So ultimately, if you go into your average sub-Saharan African country, for example, I think the bulk of ECD spending has been on the basic health and nutrition interventions. So basic health first, and so the ministries of health have more resources, capacity, and funding than ministries of education. And so what you will typically have is model interventions, like integrated management of childhood illness is the approach to reducing childhood illness put forth by the WHO. And so an enormous number of countries have scaled that approach up, and there's a community integrated version that is more community-based. And the big intervention that has been tested as because of the Jamaican program having a lot of influence is that in quite a few countries folks have added this idea of responsive and stimulating parenting to the basic WHO modules around childhood illness, which are around health, and then exclusive breastfeeding and the supplemental nutrition, and then often actual nutritional supplements are for micronutrients and those kinds of things are usually part of the picture. And then, you know, some of the stuff you all might have heard about, like that peanut, the kind of spread that has protein together with micronutrients. So these things to try to address stunting. So stunting has been a concern of a lot of governments. And so that is kind of there in many countries. It has a lot of variation because of the capacity of the community health worker workforce. And then this addition of parenting is more or less successful because community health workers can be so overloaded that you give them a whole bunch of other things to talk about and encourage around responsiveness and stimulation and singing to your kid and talking to your kid. Well, some of them are actually, it's called mission creep, but they've been tasked, like in Malawi, to actually provide medications for HIV and malaria and tuberculosis. So that's now become part of your job as a community health worker because the families can't make it to the district or the health clinic. Then how are they going to be able to implement this? So our Malawi project is to actually test this addition of this parenting module within two systems. One is that health worker system, and we're not that optimistic about it, and one is a kind of community mom training approach. So I think in the 0 to 3 area, the big push right now is to try to add parenting because the Jamaican program showed that it was the parenting component that had the long-term effects. And the Pakistan trial, the same 4 arms, same set of results. It's the parenting intervention that is showing the cognitive effects on kids. And those cognitive effects in these places are similar to the US data. At least in the Jamaican study, you're seeing these long-term effects on things like educational attainment. So the reality is health and nutrition are already there to some degree. Those have been responsible for reductions in infant and under 5 mortality. And then I think the question is, what about learning? And should we then now move to the problem with sub-Saharan, the low-income countries on average in 1990 had 11% pre-primary attendance, and in 2010 they had 15%. So at that rate, they're never going to develop any kind of pre-primary education systems. So that's the rationale behind, I think, the goal, setting this goal, because we knew that all the mortality and survival things would still be in there. That's all under the health. All the health goals that are incomplete are still going to be there, and there is no controversy. There's no controversy about measurement. There's no controversy really about what to do. It's just that governments have to invest more in further improving things like infant mortality and reducing stunting. But I think then the question is, if we're focused on learning, and the big focus in global education is now the shift from inputs to learning. Like, we actually now want to know about learning, and we want to start moving towards other domains than reading and math. And so I think that's where the argument for pre-primary is coming in. And evidence from low and middle income countries that preschool is showing very positive effects, like, on average positive effects, like the US, with counterfactuals that also are just more deprivation, I would say, and more disadvantage than the US. So. But that's a good question. It's like, with limited funds, how do governments make decisions? And this next phase, where it's really not my area of expertise, but kind of talking to folks who have this area of expertise around finance mechanisms, it will be really interesting, because part of it will then inform how governments make decisions about how to make trade-off. How do you make a trade-off? You have 100 indicators. Some are about biodiversity, some are about climate change, some are about health, some are about education, some are about poverty reduction. You're a low-income country, or you're an NGO. Like where do you put your money, right? So it's a big question. So, yeah. One more back there, and then we'll probably have to end.
I had a question about the ESA cycle and improvement that because I feel, from my research and experience with them, I feel that, sometimes they're kind of pitched as getting a whole bunch of stakeholders and practitioners and experts in a room where they kind of develop innovation where you might want to test out. But sometimes, too, I think it's also been pitched as, just because sometimes we have these best practices that are backed up by research, and a lot of times practitioners will say, well, our context is different, and I think sometimes these PDSA activities are also consider the function of kind of being a vehicle to introduce these best practices and having practitioners try them out in their context, which they might think might be exceptional, and then getting them to have some kind of empirical pre-test, post-test to see if they can see some results, and maybe to let the quantitative results speak to the practitioners and possibly create buy-in in that sense for these small trials. So I guess my question was to you: do you have a sense of where this implementation falls in that continuum of that is an accurate model in terms of developing kind of genuine original innovations versus kind of helping practitioners develop buy-in for what would be considered research-based best practices in most contexts?
Yeah, that's a great question. I know it uses words like the breakthrough model and these kinds of things, and so though perhaps the majority of folks are working from their own experience, and so there's a question of whether an innovation that might come from some other field, for example, would that just come up spontaneously within this kind of model? So I think that's a great question. There's a lot we don't know. I'm glad that we continue to collect these more distal kinds of measures like the class and child outcomes, because I think those are still going to be really important indicators. I haven't one of the things we've talked about is there any way to link all these school-level metrics of change to anything that is across the entire sample? And I think that's interesting. I don't think anyone's ever done that. I don't know whether Tony or any of his groups have done that, or you guys are doing that, but that might be an interesting thing to do. But it means you have to collect something that is tracking something more distal than the micro-level improvement that's going on at that point, right? And then I think the idea of integrating something like that with controlled evaluations can be done. I think people would, the immediate reaction might be, oh, you can't control something like that, but you can do anything you want, given the unit that is controlled or randomized or whatever the thing is. So I think there may be approaches, and maybe that's the next stage in this kind of research, is to kind of then empirically link what is going on in these metrics of change in the learning sessions to longer-term improvements in a system, and ultimately what we care about, which is how kids are learning, right? So I gave the kind of minutes of instruction example because I think that was a positive example where there's something that is, I would say, research-based. If we believe that these instructional strategies, that more minutes of them, particularly in a context of very low minutes of instruction, which is true in US preschools too, right? So we, even though I was surprised by our data, Catherine Snow was not, because she knows the preschool, she knows what happens around language instruction in preschool, so she was not surprised that we had numbers below 30 in a preschool, in a half-day kind of preschool day. So this notion of increasing that was an example of, oh, here's something that the group could agree on, and it happened to be evidence-based. And so that's an interesting question of then, did the minutes increase? Would we see that in the videotape? Maybe if we redid the fidelity kind of study on our videotapes and got another army of 15 coders to go through every minute and count up those kinds of things, what would we see? Those are the kinds of things I think that we would want to know. And then try to see if these metrics had anything to do, progress on those metrics or schools that are more engaged have anything to do with it. It's a big question. Well, thank you very much for your time.